61 tonight. Sunny 88 tomorrow. Sunday sunny, high of 89. Do you want to throw away your money through the attic or garage this summer? Or would you rather save up to 20% on your AC bill? Call USI Mesa Insulation at 602-346-9287 and get a pair of spring training tickets just for calling. I'm staff meteorologist John Weatherby.
81 degrees right now. The Dow down 224 points at 17,672. S&P down 21 at 2,045. The NASDAQ down 40 at 4853. Reporting for Money Radio, I'm Ken Morgan.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. My name is Bob Roth. And welcome to Health Futures, Taking Stock in You. We're a weekly show found right here on Money Radio, 1510 AM, 99.3 FM. And happy 13th, March 13th, Friday the 13th. It's hard to believe. And I got a guest here on the show today who is a return guest, Dr. Ed Perrin. He was on our show here back on February 14th, Valentine's Day last year. Welcome back, Dr. Perrin.
It's nice to be back. Thanks, Bob.
So Friday the 13th.
Yeah.
What's it known as?
Don't walk on any ladders with black cats in front of you. Superstitions. Triskaidekaphobia, fear of the number 13.
Fear of the number 13th. And March is such a great month because we have so much happening here in March.
Yeah.
We've got the March Madness coming up.
Spring training.
We got spring training right now going on.
Yeah.
And your partner in crime here, Kara, said we also have St. Patrick's Day.
We do.
And you've got a birthday and an anniversary this month. Wow.
It's a big month.
It is a big month. And we got the Ides of March coming up, too.
Beware.
That's what, on Sunday, March 15th.
Mm-hmm.
Well, happy Friday, and Dr. Perrin, welcome back. And you have changed.
Mm-hmm.
Changed careers. You're still in the physician profession, but you changed what team you're working on.
There you go.
And the team, in using the metaphor for spring training, is a really innovative team. And I really would like you to tell our listening audience, because you're a geriatric physician who's gotten great notoriety here in our community, and you heard about these guys coming to market, and you were excited to join them. Tell us why.
I'd love to. The new company is called Iora Primary Care. That's IORA Primary Care. It's a primary care company. I'm a primary care doc, first and foremost, family doc. Like you said, I'm geriatric medicine boarded also. Geriatric medicine is all about primary care, taking care of older patients, their families, knowing where they fit in the family and the society. And what's nice and refreshing about Iora is it really is putting that emphasis back on the primary care part of it. Primary care, we believe, is really where medical care should start and end. Secondary care is important. That's your subspecialists, your eye doctors, your heart doctors, your skin doctors, your surgeons. Tertiary care is important. That's your hospital settings where all the subspecialists are coming in. And those are valuable and very important and life-saving often. But that's not where most people should be getting their care, and should certainly not be where their care is being directed, and really where primary care should be directed. So that's one element that really Iora Primary Care is really relishing and keeping and providing primary care at the front of everyone's health care. The other thing that's different, and what really drew me to Iora, is its emphasis on a team. Especially in geriatrics, the days of the doctor riding off into the sunset and being the hero and saving everybody are really long gone, and that can't happen anymore. Patients and medicine is so complex that you really need a team to help take care of patients, and that's where IORA comes. So we have a very discrete team, both on the clinical side and on the non-clinical side. You mentioned Cara, my partner here, working sort of on the non-clinical side, making sure that we as a company and we as medical providers are integrated into community and really understanding that patients are not just patients when they walk through the doors, but they're people and they're members of families and communities, and we want to understand those relationships also. And that's the last piece about what IORA really is about, is a relationship. We think that the nature of medical care has become so distorted and perverted in America that no one is aware that it really should be based at foundation of medical care on a relationship. And so IORA says, let's revisit that. Let's figure out why the relationship's been broken and how can we fix it. And that's part of our team approach. So that's sort of the high-level summary of what IORA has done. I can get more into it and tell you what I'm doing, what we're doing as IORA, what our company's doing across the country. It's a company based in Massachusetts with lots of different partnerships with different patient groups. And when I heard that they were coming to the Valley, I really leapt at this opportunity because I'd heard about them and I'd heard about their founder years ago in some of the popular press and in the medical press. And it became an opportunity I couldn't pass up. I was so excited to meet them and to meet the culture of this company that really values relationships obviously between providers and patients, but also relationships within the company, really recognizing that if you're unhappy at your job, you won't be a good provider. And I'll get into that also. There's a lot of talk about the triple aim of medicine, and recently people are talking about a quadruple aim of medicine, and this fourth aim is something that IORA has really been aware of from the very outset, which is provider satisfaction needing to be there, because no matter what's working in the system, if the providers providing that care are not happy, satisfied, then they will burn out and the system will break down, regardless of the quality of the care, the cost of the care, and the efficiency of the care.
You know, the two things you said that really resonate with me. One is team. You have a team-based approach. Mm-hmm. And two, you said community. And Kara's here, Kara Campini, who is a community engagement leader, if you would. You have multiple locations with plans for more. Mm-hmm. Tell us a little bit about the locations that you have here, and what are the plans for IORA to expand?
Mm-hmm. Right now we have one location on 67th Avenue in Peoria in Glendale, mm-hmm. and another one on 31st Avenue and Indian School in Phoenix. And hopefully we will be expanding. I think that a big part of the mission of IORA isn't just to serve the patients that we have well, but we want to transform healthcare for everyone into the community that we go into. So a lot of the stuff that we'll do, as members of our care team will actually go out into the community and give workshops of how to get the most out of your doctor's appointments and such like this, so that we can really kind of teach people to expect more from their healthcare, because, we know that when you go into a doctor, you're going to have to wait 3 months to get an appointment. You're going to have to wait an hour once you get there. You're going to get 3 minutes with the doctor. They're going to prescribe you something or refer you out. And that's all you're going to get most of the time. But we really need to teach people to expect more because, IORA can provide more. And we want to change the system so that everyone's getting more.
And, our listening audience is hearing you say that, Kara. And it definitely is resonating with them. It's hard to believe that's what we've grown accustomed to over these years. That we wait 10 to 12 weeks to get an appointment. We wait an hour in the waiting room, and we sit in these exam rooms, and we read old People magazines and other publications, and we wait, and the doctor comes in, and we might get 3 minutes with them. And some of these doctors have on the back of the door that they only will take 3 problems at a time. And if you need more time, schedule another appointment. That means I got to wait another 10 to 12 weeks.
Yeah. I'd love to see what would happen if a mechanic did that. If they said, we'll only talk about 3 issues with your car, you're going to have to come back next time if you want to talk about the 4th. Your body's a system. It's crazy that that's how we do it now.
Well, and I think a lot of it's teaching and it's educating. And, Dr. Perrin, and I've known Dr. Perrin for a number of years, deep down to the root of who he is, he's a teacher. And he's an educator. And we're talking about educating the community, and we're talking about educating the people that come in the door to see us, educating them how to live. What our show, the premise of our show is how to live a healthier, happier life, and Iora assisting them in doing so. I know we're coming up on a break. I'm excited to talk about Iora and how it is changing the shape of the delivery of healthcare in our communities, and emphasizing a team-based approach, also emphasizing the community and being that resource to the community. With that, we're up on a break. You're listening to Health Futures, and I've got Iora Primary Care in the house. I've got Dr. Ed Perrin, and I've got Cara Campini. We will be right back.
Hi, Joe Capitano here, Senior Vice President with Homeowners Financial Group. And I'm a human being, not a machine. Do you get embarrassed easily? I mean, if you were the only one who forgot to bring the gift to the holiday party, would that embarrass you? Well, what if you couldn't afford your dream home, your first home, your last home? What if your loan was denied? Now that would be embarrassing. Well, I don't want you to be embarrassed. That's why I listen to you, and I use my many years of experience to help you realize your dreams, help you find the loan and the financing you need. See, a machine, a computer, a website doesn't care if you're embarrassed. It takes a human being like me. Call me, Joe Capitano, 480-305-8545, 480-305-8545, or just go to joeloans.com. Bank number 090-6222, MLS number 9826, Equal Housing Lender. That's 480-305-8545 or joeloans.com.
Are you ready to start receiving Social Security? Do you have a plan on how you're going to withdraw it? Call Certified Financial Planner Nancy Fleming of Fleming Financial Services to learn more about the role Social Security plays in your overall retirement plan. Will Social Security be the foundation for you? Is it a nice addition to what you've already planned out, or is it going to be better for you to wait to start receiving your Social Security benefit, or should you start sooner? These are very important questions you need to ask yourself before you retire. Call Nancy Fleming today to schedule your free Social Security analysis. 480-632-8770. Nancy Fleming is driven by one focused goal: to help clients grow, protect, and transfer all they've worked so hard to achieve. 480-632-8770. That's 480-632-8770, or visit FlemingFinancialServices.com. By contacting Fleming Financial Services, you may be provided with information regarding the purchase of investment or insurance products. Business owners, think SRP Custom Rebates. Bring SRP your unique energy-saving challenges, and they can help you find out-of-the-box solutions to save energy and money. Get started at SaveWithSRPBiz.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. My name is Bob Roth, and you are listening to Health Futures, taking stock in you. We're coming at you live from the Scottsdale Air Park here on Friday, the 13th of March. And if you're just tuning in, I've got Iora Primary Care in the studio with me. I've got Dr. Ed Perrin, and I've got Cara Campini from Iora Primary Care. If you missed the first segment, you can catch it up on our website at cypresshomecare.com. Push on the radio button up on the top, or I've got a radio microphone button halfway down on the right, and you can catch the show there. You can catch this first segment, and of course these next three, and about 60 others that we've done since January 2014. So let's talk about Iora. So, I want to talk about the things that we talked about just before we took the break, and that was the community and serving the community with this team-based approach. So how does one find Iora, and how do we sign up, if you would? How do I connect with Iora, and what would that look like?
Mm-hmm.
That's great. I'd love to have everyone come through the doors. We are a Medicare only practice. I want to make that. This is a senior. This is a program focusing on aging and healthy aging. So that's why I'm happy to be here to really talk to those types of patients. So a Medicare-only practice. It is, in some ways, concierge medicine for Medicare. So as a Medicare beneficiary, you have huge rights, having put in all that time working for the United States, in the United States. So it's time to get your money's worth. And Medicare is a huge institution, and IORA has been able to develop some special relationships with some of the Medicare players, which allows us to do what we're doing so differently. Were you to be a patient at IORA, I think the first thing you'd notice when you drive into our parking lot is it's not in a medical office building. And that's a very deliberate choice we've done at IORA, so that if you have other family members or even yourself, if you want to do another errand, in the traditional world, you go to your doctor's office and there's just other doctor's offices and there's other labs and maybe some x-ray places. You can't do anything but medicine when you drive to see your doctor 99% of the time. We have deliberately chosen retail space to set up our doctor's offices so that if you want to grab a bite to eat, there are restaurants. If you want to get your hair cut or your nails done, there are retail shops there. There's a Walmart, or in one of our settings, it's a Walmart shopping center. So go to Walmart. So you can park. You can either leave the kids or grandkids to do something else, or you can do your own sort of other errands. So it's more one-stop shopping instead of driving and parking and finding another handicapped spot. And it's hard. We want to make it easier to access your care, and again, limiting the number of trips you have to make is one way we can make it easier. So the first thing you notice coming to IORA, it's not a typical medical office building sort of in this wonderful sort of medical park. It's a retail space. We've had a lot of people come through our doors, whether they be lab delivering people or U.S. Postal Service, the UPS, or even patients. They walk in through our sliding doors, and they turn around, they walk back out, and they come back, and they check the sign out front, and they come back in, because when you walk through our doors, it doesn't look like a doctor's office. It's a reception area. It's a living room almost. We do have magazines. They're not as out-to-date as most. But we also have games and puzzles. We have treats. We have snacks. We have coffee. We have a receptionist, if you will. And again, back to our team, everybody plays the part of a receptionist, whether it be the doctor, whether it be community engagement, whether it be a nurse or a coach. We all take turns sitting up front with our laptops, and that's it. There are no windows. There's no imposing sort of cubicle where someone's on the phone holding up a finger, letting you wait for a moment. You walk in, there's a round table, a person sitting with a laptop, and we welcome you in, and you check in. If you have a copayment, by law we're required to collect it. It's the only time in IORA's history that we've collected copayments, because we don't think money should get in the way of delivering medical care. So anybody else outside of Medicare that's with IORA doesn't have any copayments. Some people in Medicare do have copayments, so we're forced to collect those, and we put those right back into our community work. And then you sit at the waiting room and have some coffee, have a snack, meet with other patients if you want. And soon thereafter, you'll have a health coach come greet you and take you back to either an exam room or a consultation room. And this really brings up the other cornerstone of our practice is we have a health coach that is an integral member of the team that I work with. We talked a lot about the relationships being broken in medicine, and one of the ways that we're hoping to fix the relationship is having a dedicated coach that can escort and usher and chaperone and navigate through the healthcare system with our patients. Health coaches can be medical. They don't have to be. They're really all about the relationship and letting patients feel comfortable talking about whatever they need to talk about when they come through our doors. The health coach escorts you to the room, gets you settled, alerts the doctor that the patient's ready, and the doctor comes in and the coach remains in the room. I'm going to sort of abbreviate things now because the doctor comes in, finishes up, the doctor leaves, and the coach is still there and wraps things up, makes sure that everything is understood, what's going on after that doctor's office, after that doctor's visit. Lots of times the doctor says things in doctor speak, and we do speak a different language from Americans. And it's really not understood. So this enables the patient to say, I didn't really understand what the doctor meant when whatever I say. And so there's a translation that happens, a literal translation, sometimes from doctor speak to English or from doctor speak to Spanish. And then the patient leaves, and there's follow-up by phone, by email, in person as necessary. The other thing that's different about our practices, because they're Medicare-based, is they're very senior friendly. So there's grab bars on the entire walls throughout the practice, so that if you have some difficulty with mobility, it's easy. You don't get too fatigued walking back to the exam room. Our exam rooms all have hydraulic exam tables, so you don't have to struggle to climb up the 3.5 feet to get up to the level to sit down to be examined, and then so you can sort of transfer right on over to a low bench, and then I can raise the bench up if I need to examine you. They're spacious, so that we can involve, again, family and community. I had a patient come in in a wheelchair, with her husband in a wheelchair, with their private caregiver, along with me and the coach and a second doctor, all fit very comfortable in our exam rooms with no sense of crowding, enough chairs, big tables, so that we can really welcome everybody that's important in that patient's life. So that's just an element, sort of how it works. I think the last piece that's important for your listeners to know is that, like I described at the beginning, we have a special relationship with some of the Medicare players, and in this community it's with Humana Advantage. And so we have very special relationships with Humana Advantage that allow us to deliver this type of care to their members. So our patients have to be members of a Humana Advantage plan to, again, that's a Medicare program that Humana provides. And that's how we get to spend time. And that's a final piece, I guess, is the time I spend with my patients. New patients, I usually spend over an hour. They spend well over an hour in our office. Follow-up patients typically no less than half an hour, unless it's something simple like a cut or something like that. None of my patients are simple or straightforward, so even if they think they're coming in just for a simple cut, I may say, well, what about these other issues that were brought up last time? Let's make sure those are still being managed and taken care of. And so there's no limit to the number of problems you want to discuss with us. There's really no limit to the time you spend with us as a team. The team involves a coach, as I've described, so we've broken that dysfunctional doctor-patient relationship that really has vanished, we think, in most of America, especially at the primary care level, and inserted a third member to that relationship, and that's the coach. So it's a patient-coach relationship that really is strong, and the doctor's an element in that. We've had patients numerous times, we've only been doing this for a few months in town, call and say, I want to talk to my coach. I don't want to talk to my doctor. I have issues I want to really review with my coach. And the coach brings the doctors in as necessary, but it's really heartening to see that relationship. And we know lots of data support that if patients are engaged with their health and their illness and motivated, and that's really what the coach is all about, then their health ultimately improves. Finally, I'd like to say that it's not just the coach and the doctor. We have nurses in every practice, and we have a social worker in every practice also to provide additional support. Again, I'm just the doctor. I can't take care of patients by myself. I need these critical clinicians to also help me.
I went out to the website, and I want to give this to the listening audience. Please. So they know how to get a hold of IORA, and that is go to IORA, and that's IORA, primarycare.com/Phoenix. Mm-hmm. And when you land on that page, you see people, real people. You're not wearing lab coats and you're not real stuffy and standoffish. You guys look like you're having fun, and you guys look, and you look like regular people. And I think from a standpoint of being a patient, that's disarming to them, and that gives them the ability to be more comfortable in that setting.
We'll talk more after the break.
We will. And by the way, if you want to reach them, you can reach them at 602-325-5580. You're listening to Health Futures, Taking Stock in You, and we'll be right back.
The commander of NORAD is watching Russia's military. Correspondent Joe Johns reports.
Admiral Bill Gortney laid it out in written testimony for the Senate. He says Russia is making progress toward its goal of deploying long-range conventionally armed cruise missiles with increased launch distances.
Then, as correspondent Ivan Watson reports, there's Kim Jong-un.
The South Korean Defense Ministry says that North Korea fired a salvo of at least 7 surface-to-air missiles during a period of about an hour on Thursday evening.
A day after 2 policemen were shot in Ferguson, Missouri, protesters called for calm but vowed to keep working for change. And Pastor Tracy Blackman felt last night's protest was more relaxed.
I saw protesters able to exercise their rights and police officers not being threatened by the exercising of those rights.
Half an hour before the bell, both the Dow and S&P are down about 1%. I'm Evan Haining.
Imagine a store that lets you get anything you wanted. An HD flat-screen TV, a high-capacity, ultra-quiet washer and dryer, a complete living room set. And imagine if you didn't need a lick of credit to get it. That store simply believed in you. Imagine if they even delivered it, set it up, and serviced it at no additional cost. Well, that store exists. That's Rent-A-Center. Imagine that. No credit needed. Affordable payment plans. Delivery, setup, and service included. Imagine new possibilities at Rent-A-Center. Rental purchase transaction. See store for details.
Geico Motorcycle presents Reflections from the Road.
Let me tell you, the road is a much more relaxing place since I switched to Geico Motorcycle Insurance and started saving money. With that taken care of, now I can think about deep, important things. Like how come it's a pair of pants when there's only one of them? A real brain teaser. But hey, at least saving money with Geico Motorcycle is as easy as pie. What does that mean, anyway?
Geico Motorcycle Insurance. See how much you could save.
Move over. TD Ameritrade and Scottrade. There's a new leader in the pack of the finest trading platforms in the country. That's right, Phil's Easy Trade platform, designed by professional traders, and is why it's so easy to navigate, so easy to execute, and includes the most important and advanced features that give both professional and novice traders the edge they would expect. So simplistic, so stealth-like to assist you in building your profit center. For information on Phil's Easy Trade platform, go to philsgang.com or call 877-600-GANG.
That's right, folks. philsgang.com now offers a stock trading and investing platform. This unique platform is fast and designed for performance with the integration with PTT1 and PTT2 stock charts. It will also be tailored to the way that Phil's Gang teaches you in class. For more information, simply go to philsgang.com or call 877-600-4264. 877-600-4264. That's 877-600-4264.
There are thousands of qualified captive financial professionals who work as employees for large national insurance companies and brokerages. There are also many independent financial professionals like Steve Netzel of Netzel Financial who are not bound to any given insurance company, investment strategy, or product. If your financial planner is an employee who is contractually bound to represent only specific products, imagine the hundreds of other options out there that could be a better fit for you. At Netzel Financial, they believe in helping those who are in or nearing retirement, and that your financial future deserves a truly objective opinion that looks at more of the options that are available, giving you a financial plan that's custom tailored to your needs. After all, it is your money. If you'd like a second opinion when it comes to your financial future, call Steve Netzel of Netzel Financial at 480-219-0657. That's 480-219-0657. Or visit them at netzelfinancial.com. Netzel Financial.com.
I'm Bruce Vail with Your Money Now. Consumer confidence is down a bit this month, with the decline concentrated in lower and middle income households facing higher utility bills. But some economists expect the decline in the University of Michigan Sentiment Index to be short-lived as the weather starts to improve in many areas. The family of a Georgia woman whose death in 2010 led General Motors to recall more than 2 million vehicles and prompted federal investigations has settled a second wrongful death lawsuit against the automaker. The suit claimed GM withheld information during a prior lawsuit over defective ignition switches. Terms of the settlement were not disclosed. GM shares are down about 1%. The broader market is sharply lower today as the dollar continues to strengthen against the euro. The Dow Jones Industrial Average is down 210 points. The Nasdaq Composite is off 37. The S&P 500 down about 20. That's Your Money Now.
I don't care what they say. If you own a business, you did build that. You faced the tough challenges and you made the smart calls. So if your business is growing and you need more space, make the smart call today. General Steel. Our buildings have been used around the world, saving our customers as much as half the cost and time of conventional construction. As much as half. If your need is for storage and manufacturing, sure, we're the best. But with our custom exteriors and designs, General Steel buildings are used as offices, churches, retail stores, and more. Imagine a 5,000 square foot building for less than $35,000, or even 10,000 square feet for an unbelievable price under $75,000. These are prices you just can't ignore on a building designed specifically for you. Make the smart call and call General Steel today at 866-95-STEEL. Save as much as half the cost of conventional construction and own the space you need. Call 866-95-STEEL. That's 866-957-8335.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. My name is Bob Roth, and you are listening to Health Futures, taking stock in you. We're a show found here on Fridays, right here at noon, from noon to 1 on Money Radio, 1510 AM, 99.3 FM, and we're coming at you live from the Scottsdale Air Park. And if you're just joining us right now, I've got Iora Primary Care in the studio. I've got Dr. Ed Perrin here with me, and I got Cara Campini, who is the Community Engagement Leader. And Dr. Perrin, we've learned a lot about what Iora is doing and really how they're changing the shape of the delivery of healthcare. You mentioned it's only been a few months. How long have you guys been here? And when did you guys open?
Sure. We opened our doors to see patients October 1st, just last year.
Okay. So about 6 months.
Yeah, about 6 months. Iora was founded back in Massachusetts as a company in 2011 after about 10 years of frustration by another primary care doctor who is our founder and CEO. His frustrations trying to do primary care in the traditional system, if you even want to call it that. And then after multiple attempts at different settings, he says, I got to do it myself. And so he founded Iora Primary Care, started in Las Vegas and started in New Hampshire, and has sort of spread over the country over the last 3 to 4 years now. We opened these two practices in the Phoenix area in October. At the same time, we opened 2 practices in the Seattle area in October. We're going to probably open a 3rd practice in the Phoenix area later this year, possibly a couple more elsewhere in the state and across the country, other states with Iora, the same model with primary care, really taking the forefront of medical care and transforming how patients experience it. I said last segment, people walk in our doors, don't even think it's a doctor's office, and they leave dumbfounded that they've just had an experience in primary care that we hope is raising the bar for all primary care doctors. And we've heard that in other communities that we've actually been criticized. Don't do what you're doing. You're making it too hard for other primary care doctors to make a go of it because your care is so great and your the model is just so different.
To me, that sounds just so wrong that people are telling you not to do it because you are doing it right.
Right. Yeah. So it's really, we're revolutionizing it. We're really hoping that this, and there are some imitators coming around. I've been involved in other healthcare settings, as you know, and this is really, I think, the best job I've ever had as a doctor in over 10 years of doing this. After all my fellowship training, it's been over 10 years, and it really is refreshing. This is really what I wanted to do as a primary care doctor, is to spend time with my patients and their families. And when I'm not, again, a busy day for me, let me frame this for you. A busy day for me is going to be seeing about 10 or 15 patients. That's busy, crazy busy in Iora world. A busy day for my primary care doctor would be seeing about 35 patients. So I'm seeing a lot fewer patients because I'm spending more time with them and more time coordinating their care and understanding their care, reviewing their records, calling their cardiologist or their dermatologist, or calling the hospital when they're in there, calling their daughter in Illinois, whatever it takes to understand this patient, take care of this patient, calling him or her back multiple times, tasking my coach to say, please follow up and make sure that, yes, he's got some early signs of diabetes, but with some changes in his lifestyle, he won't become diabetic. And so we're doing a lot of prevention in our practice, a lot of discussions about what patients really want. Do they want to go to the hospital? Do they want an x-ray? Do they want a blood test? If they do and they understand why, let's get it to them and make it as easy as possible for them to get those tests with as few barriers from a money standpoint, from a time standpoint, from a ease standpoint. Let's make it simple and straightforward to get the care that they need and want, as long as they understand it. So it's really refreshing. It's really an amazing experience. Cara mentioned, we'll go out to the community. We're going to senior centers. We're going to faith communities. We're going to assisted living communities and saying, here's what we are. Here's what you should be expecting from your medical care, whether it be from Iora or from other settings. Get the care you deserve as a Medicare beneficiary. It is an American right. I feel very patriotic providing this care because this is for Medicare patients. It's a system that's been broken. Let's try to fix it from the outside, which is where Iora is coming from. So that's kind of, it's amazing. It really is. I encourage listeners to come take a tour to see what we're talking about. We're open to tours, even just peeking through the front doors to see that it really doesn't look like a doctor's office, doesn't feel like a doctor's office, and ultimately people come back extremely satisfied and their health improves.
Do you have to be on the Humana Advantage plan to come see you, or can you just be a Medicare patient?
Right now, because I can deliver better care and spend more time with my patients, it's because I have an agreement, or Iora has an agreement with Humana Advantage. And so right now, that's the only insurance that we're accepting at Iora.
And the thought is to expand that to others.
That's way beyond my pay grade.
Okay.
Yeah, that's up at the corporate level.
Well, you know what's interesting is you sit here and talk about the health coach, and you talk about preventative stuff. And you and I have had this discussion, Dr. Perrin. I mean, we have this thing that we call healthcare that really isn't healthcare, it's sick care.
Mm-hmm.
I mean, that's really what our healthcare system is. It is sick care. We don't reward our members in our communities to live a healthier, happier life, the premise of our show. But you guys are taking it down to the level where you've got these health coaches, and preventative medicine is very, very important to be able to have your patients be able to not become diabetic, to not have other health-related issues by living that healthier, happier life. Having that health coach, you said email or call patients?
Or come in and just...
That's unheard of.
That's why we're doing what we're doing, because it is so refreshing, and it's really sort of back to the future. This is what primary care docs did at the turn of last century, right? Which is sort of, come see my office, I'll talk to you, I'll spend time with you.
Come see my office and wait.
Not 100 years ago.
No, not 100 years ago.
And what else did those docs do 100 years ago? They did some house calls also.
Yeah, I want to talk about that because you were in that space with an employer many years ago, and you were going into the home setting.
Right.
And you and I both know with the aging adult population, you really don't get a good snapshot of what their life is like when you spend, whether it be 3 minutes with them in the exam room or even an hour. You really can't grasp that unless you get into their home and see what's going on.
Right.
So at Iora, you do make house calls.
We do. It's not built into the schedule, which I think might change as we expand, depending on what, and as we grow and as we age. So I think my 68-year-old, relatively healthy patient with a few medical conditions in 10 years, despite all our best efforts, might not be as healthy at 78. And I think in those times, and certainly I have some patients right now, that it's really hard to come to the doctor's office. And so I do house calls, not on a regular basis, but sort of on a case-by-case basis.
Right.
And we'll decide as a team. My nurse might tell me, Doc, you really want to go see that patient at home. Or the coach is going to say, I've heard what's going on. Let's go make a house call together, and we'll do that. We've done that. It's really rewarding.
It is the big reveal, though. I mean, when you go into that home and you see how they're living, you open up the refrigerator, see that they may be just eating cereal and there's expired food in there, or there's no food at all.
Right.
I mean, in home care, that's where we really get to see how that person exists and how they're living.
It's eye-opening, and I enjoy my home visits tremendously. It's been part of my... identity as a primary care doctor since day one when it was required in my training to do home visits, and I took that with me in every employment setting since then.
Well, I love what you're doing. I want to hear a little bit more. I know our listeners want to hear a little bit more. We're coming up on a break. You're listening to Health Futures, taking stock in you, and I've got Iora Primary Care here in the studio. If you want to reach out to them, you can call them at 602-325-5580. We're going to take a break for our listening audience, and we will be right back.
Right after Business for Breakfast, right after the news at 8 a.m. Monday through Friday, don't miss Mastering Money, the new show with best-selling author and certified income specialist Steve Jurich. Sinclair No joins Steve, as well as experts and authors from the world of Wall Street and real estate. Get a handle on market trends, asset allocation, IRA decisions, Social Security, RMD planning, tax strategies, estate planning, and more. That's Mastering Money, Monday through Friday at 8 a.m. right here on Money Radio. For more, visit IQWealth.com. You can't afford to miss Crude Awakenings with Brandon Cox at its new time, Monday mornings from 9 to 10. Crude Awakenings takes an in-depth look at the modern-day oil boom and the economics behind it. Brandon Cox, the CEO of Pipeline Oil and Gas, along with top industry experts, will educate you on how you can reap the financial rewards associated with the proven techniques of developing energy assets. So, share your morning with Brandon Cox and Crude Awakenings right here on Money Radio 1510 AM and 99.3 FM.
Laura Bramnick is a real estate agent and a real estate attorney and a consumer advocate. If you have distressed property, a possible short sale or foreclosure, you need more than a real estate agent. You need a good attorney. You're not alone. Laura can help. For more information, visit talkrealestateaz.com or call 480-624-2705. That's 480-624-2705. To talk with Laura, call 480-624-2705.
Money Radio 1510 and 99.3 FM invites you to tune in to the One Show with smart money strategies for you. We take your calls and questions about your financial plans and retirement plans every single day on The Ray Lucia Show. That's Monday through Friday from 8 until 9 a.m. on Money Radio 1510 and 99.3 FM.
Tune in this and every Wednesday at 9 a.m. as Ray is joined by Medeiros Futuro. Visit PreciousTimber.com for more information. Business owners, think SRP Custom Rebates. Bring SRP your unique energy-saving challenges, and they can help you find out-of-the-box solutions to save energy and money. Get started at SaveWithSRPBiz.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. My name is Bob Roth, and you are listening to Health Futures, taking stock in you. And I've got Iora Primary Care here in the studio, and I've got Dr. Ed Perrin, and I've got Cara Campini, who is the Community Engagement Leader. And Cara, we haven't heard a whole lot from you today, and one of the things we were talking about at the break was some of the other things that Iora is doing in our community. And I want our listening audience to learn a little bit about what you're doing. We know that you have 2 locations. You've got one on West Indian School Road at about 32nd Street, and you've got another one at 66th Avenue on Peoria Avenue on the west side. So please tell us about some of the other things that you guys are doing.
So I think, Dr. Perrin was talking a lot about the team-based approach that we have to our care. So in a traditional doctor's office, you'll go in and really the relationship, as much as there is one, it's doctor and patient. And that's really how you're going to affect change in someone's health. In our practice, it's doctor, patient, health coach, maybe behavioral health specialist if that's what's necessary, caregiver. But there's also this other piece, which is your peers, your community, right? And so it's kind of built into the space and built into the programming at our practice. when you walk in, it kind of feels like a living room. It also a little bit feels like a community center just because our reception area is so big. We also have a group room where we'll do exercise classes. So Silver Sneakers, we actually have an instructor that comes to the practice and does Silver Sneakers there. And so you have, a group of our patients that all have the same doctor and all have the same health coach and are all going through the same things with their health, exercising together.
So cool.
So you can bet that after Silver Sneakers is over, they all move out to the reception area, hang out, talk, eat some snacks, and
healthy snacks, right?
Healthy snacks, and a group of them have decided they want to start a writing club to talk about some of the stuff that they have experienced in their life and leave that for their children as kind of a legacy for them. And so, when we're talking about changing your diet and exercising, these are real serious life changes that you're making that you can't just because the doctor tells you to. It's just too hard to just do it that way. And so our practice incorporates that kind of stuff, and so it feels like a community center with a doctor hanging out at the back that you can talk to for advice if you need to.
And have access to them. Mm-hmm. Absolutely. You hit on something that we talked about before we even started the program today, and you talked about behavioral health. Mm-hmm. And Dr. Perrin, you and I attended an event a couple weeks ago that was put on by Jewish Family and Children's Service. And our guest speaker was talking about the behavioral health challenges that we have in our community. Talk to us a little bit of, especially with your specialty being in gerontology, we do have a lot of challenges that our members of our community are dealing with that are 65 and older. And they're dealing with depression and some of the other things that are going on out there. And what is being done to address those?
Oh, Bob.
I know.
I wish I could have a better news here. There's not a lot being done. We know, and I've been hearing other reports on the radio, other radio stations just this week about other elements that affect people's health. And yes, there is the physiology and the chemistry behind people's health and chemicals and medications that can help. But we know from animal studies all the way up through lots of human studies across time that if you're stressed out, and stress, you can define that however you want: family stress, financial stress, social stress, housing stress, pollution, transportation stress. If you're stressed, you're dealing with things that I can't write a prescription for.
Right.
Your health, your medical health will suffer, does suffer. Huge burden. And so we're trying to fill that gap. A lot of what IOR is doing is filling those healthcare gaps that no one else is doing. And so behavioral health, mental health, emotional health, and frankly social health. And I want listeners to think about that. What does it mean to be socially healthy? Those diseases of those systems, not the body, but diseases more of the mind and diseases of the spirit and diseases of the community, is where our behavioralist and our social worker can really help out. Coaches can do it, doctors can do it, but that's a big part of it. And Cara's team really is doing that, working with other community partners. We've just, can I even talk about this? We have partnered with a large nonprofit, nationally known nonprofit, to do some change along this line. I'm not sure it's public yet, but
we'll just say it's a large one.
It's a large one that provides food services and food support. Nutritional health is part of this. It's kind of on that edge between between medical and social health. To really see if we make people feel more food secure, will their health improve? And so we're partnering with them, again, reaching out to other community partners that CAR's been making these developing relationships with over the last year now, almost a year, to see that it's not just about patients, not just about doctors, not just about a healthcare team, but really a whole community. And I'd like to throw one last thing in. When I talk about patients and their families, and Cara mentioned this too, there are lots of unrecognized caregivers and recognized caregivers that we welcome into our practice and say, if it's not just the patient, it's the patient in society and in the family. And in-home caretakers, whether they be paid privately, paid publicly, or
family caregivers,
unpaid family caregivers, are an absolutely essential piece of this healthcare role. And as people get older and want to live at home and not transition to some institution, it's only going to get more important that we understand as the healthcare system how to support those caregivers and those agencies that are supporting those caregivers also. So I want to throw a shout out to you and your agency and everybody else in the community that's doing this extra work that is not medical, is not covered by Medicare, and is probably more important than anything that I'm going to do as a doctor, ultimately. Because if my patient's not eating, not getting dressed, not getting up, not going to the bathroom comfortably, it doesn't matter what medications they're taking, their quality of life and probably their quantity of life will suffer. So, again, it's really looking at the patient in a much larger picture, broader perspective, community, societal, and yet never losing track of that one individual person who's in front of me in my exam room where I'm spending time with my team taking care of him or her.
Well, I appreciate the shout out. And, we talk about it a lot here on our show. We talk about the importance of caregiving. And, we celebrate every year in November it being National Family Caregiving Month. And there's so many people out there, 50 to 60 million people out there that are doing this hard work every day, helping their loved ones. Mm-hmm. And sometimes it's a neighbor or a friend be able to exist in some form of independence and live in their home. And it is a very difficult task to undertake. And we talk about it here on the show. We talk about employer-based agencies like Cypress Home Care companies. And I talk about employer-based agencies because employer-based agencies carry all the insurances. They do the background checks. They do the training.
They're trained, and this is what I like about your agency in particular, is that the caregivers are trained. They know how to safely do things, kindly do things, with care, take care of our patients. Families are doing it because they don't know any other way, but they're not professionals. And when you have a professional caregiver, it makes a huge difference. I had a family just last week and this week. I saw her yesterday. Looking huge issues, living with a mother who's in her 80s, a daughter who's not involved, but the daughter in Illinois is involved, and I, at the second visit, said, you need to get in-home care.
Yeah, you do. You do, and certainly it is beneficial, especially for the Medicare population, because I've seen statistics where the caregiver, I'm talking about people that are 65 and older, the caregiver has a 63% mortality rate versus the care recipient, and that's because of the emotional and physical stress they undertake.
Absolutely.
So
it's tragic.
Our shout out to the audience is, yes, you can use employer-based agencies like Cypress, or you can be a family member who cares or a friend that cares to give that loved one the break that they need to be a better caregiver. I'm going to end with this one comment. You were on my show back on Valentine's Day last year, and you talked about how babies get touched over 100 times a day, and we have so many aging adults out there that are home alone, that don't have that opportunity to be in touch with somebody or have touch with them. And it really sounds like here we are in 2015, 15 months later, 16 months later, and IORA can do that for you with their team approach.
We like it. We call it high touch, not high tech.
I love it. I absolutely love it. Well, listen, Dr. Perrin and Cara, loved having you on the show. Please come back.
We hope to.
Thank you very much. You're listening to Health Futures, taking stock in you. Make it a great day and have a great weekend.
Thank you much.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 99.3 FM.
Life gets better because of technology. Profit and pleasure can make life happier. The program, Happiness, Opportunity and Technology, explores connections between technology-oriented investing, productivity, and satisfaction with life. I'm John Barnabas, inviting you to join me on Tuesday at noon for HOT, Happiness, Opportunity and Technology, where the menu always has selections of interest to investors and consumers. HOT, Tuesday at noon on Money Radio 1510 and 99.3 FM.
And 99.3 FM.
It's KFNN Mesa Phoenix and K257 CD Phoenix. Not a day goes by without something significant happening in the financial markets, and Gary Kaltbaum clarifies it for you weekdays at 3 on Money Radio. Dow is down 140 points right now. The NASDAQ is down 22, and the S&P 500 is down by 12 points right now.
Just ahead, Money Radio brings you the latest news, business news, Arizona business news, the weather and traffic. And it all starts